A new category of intake values has been added to the dietary reference intakes, called the Chronic Disease Risk Reduction Intake, or CDRR. The CDRR does not replace any of the existing DRI categories, but has changed how evidence on relationships between nutrient intake and chronic disease risk is assessed and used in the DRI process. The 2019 update of the Potassium Adequate Intakes, or AIs, is a useful example to demonstrate this concept. When the potassium DRIs were first published in 2005, there wasn't a separate category or process for evaluating evidence on the relationship between nutrient intake and chronic disease risk. At that time, evidence that higher potassium intakes reduced blood pressure, reduced prevalence of salt sensitivity, and reduced kidney stone reoccurrence was used to support the potassium AIs. In the 2019 update of the potassium DRIs, however, there was a new category designed specifically to characterize relationships between nutrient intakes and chronic disease risk, the CDRR. Evidence on potassium's relationship with blood pressure and with risk of kidney stone formation was reviewed to determine whether a potassium CDRR should be set. These chronic disease measures were not used to set the AI. In the updated potassium DRIs, the AIs are now based on median intakes from national surveys from apparently healthy participants, rather than being derived from experimental or controlled trials. Compared to the previous values, the updated potassium AIs are lower for all groups, except infants younger than 1 year of age. The reductions in the potassium AIs reflect the use of a different methodology. The potassium AIs are now based on survey data rather than chronic disease risk.